This episode of the Jim Stroud podcast is brought to you by Proven Base, an AI-powered talent acquisition and deep search sourcing platform that helps organizations find, engage, and hire hard-to-find candidates from thousands of real-time online sources. See it in action for yourself by visiting www.provenbase.com. Hello and welcome to another exciting episode of the Jim Stroud podcast. Today we have a very special guest. Special guest, tell us, who are you and what do you do?
Yes, happy to be here, Jim. My name is Alan Pannier. I'm the Chief Strategy Officer at SmithRx. We are a pharmacy benefit manager.
Okay, very cool. I am excited to talk to you, or rather to follow up on our previous conversations we've had, because I have been thinking quite a bit about it. First question out the bat, off the rip. True or false? The U.S. pharmacy benefit system is designed to confuse employers and employees on purpose. And if that's true, who benefits the most from all that confusion?
Oh, that is a great question, semi-loaded question, but I would say the initial answer is true with a caveat.
Okay.
I do think it's true. I think it is confusing for sure. I do think the complications lead to higher drug costs, and
Mm,
the beneficiary of that, I think it's a combination. I do think drug manufacturers somewhat benefit to an extent, but the real beneficiaries are what we'd consider big health, or like the middle layer that's administering benefits for employees and patients across America.
like everything else, follow the money.
Exactly.
Now, everyone blames Big Pharma, but you said the real problem is the middle layer. Why do you keep pointing fingers, or why do we being the general audience, keep pointing fingers at the wrong villain?
Yeah, it's really because if you think about it, the structure of healthcare and really pharmacy benefits, it doesn't necessarily follow, normal consumer products, right? You think of normal consumer products as it stands today, right? You go to a store, you've got plenty of choices on a shelf, and you pick one, and you could make that decision based off of quality in terms of, oh, I want to buy this nicer t-shirt and it's more money and I'm okay with that. Or you could be a bargain buyer and say, I'm going to choose the less expensive t-shirt, and I have the option and the ability to choose because I can see the prices and have transparency into the information. When you think about it in the pharmacy ecosystem, right, drug manufacturers are the maker of the product. And so they're the maker of the t-shirt in this example. And so it's easy to blame them because you look at the cost that you're paying at the pharmacy counter and you say, this is expensive. Why do I have to pay so much? It must be because the maker of the product or of the drug is the one setting the price. And to some extent they are. The challenges and the unknown aspect of it, though, is that middle layer that we consider big health. They sit kind of in between pharmacies and drug manufacturers and patients and employers, and help facilitate the transactions and the communications between all the parties. But they're putting pressure on drug manufacturers, and that pressure is what leads to rising drug costs.
Hmm. Hmm. I am a very cynical person in my old age. Do you
Rightfully
think that's
so.
the biggest lie ever told about rising drug costs right now?
I do. I think, what's crazy is, and it's become more apparent over the last, I would say within the last 18 months, there's been a larger focus on pharmacy benefit managers. And really in particular, what we call the big three, or the big major players in the space. And so that's Express Scripts, that's owned by Cigna. You have
Hmm.
Optum, that's owned by United Healthcare, and CVS Caremark, that's owned by CVS, or Aetna is the kind of medical side of it. But you have these big three players that consume 85 to 90% of the market, uses them, which is crazy, right? The control that they have
Yeah.
in the space. And the challenge with that is that nobody really knows about them. As I was mentioning, in the last 18 months, there's been a lot of conversations in DC on the Hill with federal legislation trying to kind of rein in the power that these companies have. There's been articles posted. You have the New York Times and Wall Street Journal both posting or publishing articles, and they don't agree on anything, but they agree that pharmacy benefit managers are a problem. And then you have lawsuits where employees are now suing their employers because of employers using these companies because they're raising drug costs. And so it's starting to get more to the forefront, and people are starting to kind of dive deeper. But really, for years, and they've kind of hid in the background intentionally.
How are companies benefiting from these rising drug costs? I'm curious.
Yeah, so the big three major players that I was talking about,
Yeah.
think about them and how why pharmacy benefit managers came to be. And maybe that's a good place to start. We can do a quick kind of history lesson here. Is you have an employer. So let's use, any employer. We could say Home Depot as an example, right? So Home
Okay.
Depot, great at providing, home improvement tools and supplies. Not expertise is definitely not pharmacy and medications. And so if I'm Home Depot and I want to provide benefits to my employees, I'm going to provide medical benefits, which you could think of as going to the doctor's office, going to a hospital, and whatnot. And so
Sure.
um, you would contract with an entity to provide those medical benefits. The equivalent exists on the pharmacy side. And so if you're Home Depot and you say, okay, I'm going to contract with an entity to do my medical side, I'm also going to contract with an entity to do my pharmacy side. And on the pharmacy side, uh, you know, what happens is historically, if I'm Home Depot and I want to provide benefits to my employees, I need to use an intermediary to negotiate contracts with all the pharmacies across the country, right? I've got employees all over the place, and I don't understand as Home Depot how, drug pricing works, and I don't want to spend time contracting with pharmacies, so I'm going to pay somebody to do that. And so that's really what ended up happening is pharmacy benefit
Mm,
managers in the early 80s, it was actually like a technology solution for you to be able to contract with this company to in real time as the employee goes to the pharmacy to identify at the point of sale, one, what is the copay or what is the cost that the member has versus the plan? And is
right.
that member even or patient even covered, right? Are they employed currently? And so you had kind of this real-time connection point between the plan sponsor, so in this case, Home Depot, and the patient that's at the pharmacy or the employee. So really that was the rationale for pharmacy benefit managers to exist. What then happened as time went on, they decided, figured out that they could provide more value. So negotiating pricing with pharmacies was kind of the first step of, hey, we're going to set up this real-time transaction. In addition to that, why don't we negotiate pricing on pharmacy for pharmacies on your behalf? Then came this idea of we've got lots of medications that exist in the market, and some of them are very similar, and so it doesn't make sense for you to cover all of them. So you take like a drug category, and say you have three drugs in the category, they're all pretty much the same. Well, you could leverage that lack of differentiation by going to these drug manufacturers and negotiating discounts, which we call in the industry rebates. But it's basically like a price concession where the PBM can go to the drug manufacturer and say, hey, if I can give you all of the volume in this drug category, like what level of discount would you give me? And again, it was well intentioned in the beginning. Hey, Home Depot, I can actually save you money by helping you manage which drugs are covered, more efficiently but still
Right.
clinically safe. But what happened over time is as they controlled and had more and more power, they started keeping pieces and parts of the revenue that was coming through that supply chain. And so where we ended up today is there's really kind of two main mechanisms that these companies make money. And it's both of them come with creating essentially this black box into drug pricing and not really ever knowing like how much you're going to pay for a medication. So the first being by sitting in the middle, I can negotiate prices with pharmacies. So let's say for amoxicillin, an antibiotic, I negotiate with the pharmacy, okay, I'm going to pay you $2 for that medication. Well, if I'm sitting in the middle, Home Depot doesn't actually know the price that I negotiated with the pharmacy. So I'm going to tell Home Depot, hey, this antibiotic, amoxicillin, costs $10. Then I'm going to keep the difference. So I'm going to charge Home Depot $10, pay the pharmacy $2. Now I just made $8 on that transaction.
Wow.
Yeah, right.
And that's, I guess, and that's legal. I mean, I
It,
guess, well, I
yeah.
guess it is, but
Yeah. I mean, it's legal, right? We call it spread pricing, right? You keep spread or the
mm,
difference. But it's, a very common way for pharmacy benefit managers to make money. And the end payer, the plan sponsor, has no idea, what that price is that's set up on the other side.
wow. And I guess employers don't know to audit this kind of stuff, or they don't care. I mean, well, I'm sure that they probably care, but how does it keep going on for so long?
Yeah, it's a great question. I think they would care if they knew. I think the audit
Right.
piece is tricky because the PBM sitting in the middle, the PBM's happy to share with Home Depot in this case, hey, here's, all of your claims information and the costs that you're paying for medications. But the contract that we have with Walgreens is proprietary. And we've got some set negotiation with them and we own that. And so you actually can't have access to that. And so there's no way for them to fully see all the way through to the supply chain. And part of the reason that that kind of obfuscation exists is due to the contracting setup that employers have with pharmacy benefit managers. So what's interesting is when they negotiate a contract for pricing, they're going to say, okay, I'm going to pay you X for doing services, but then the two main, again, levers that the pharmacy benefit manager has in controlling costs is one is negotiating discounts with pharmacies, and then two is negotiating discounts with drug manufacturers. So in the contract between, let's say, in this case, Express Scripts and Home Depot, it ends up listing pricing, but it's based on a discount-based framework. So it's looking at like aggregate discounts that has nothing really to
Mm.
do or correlate with the actual cost that's being paid. So again, it just makes it harder and harder for Home Depot to know, like, am I really getting a good deal? Because I'm looking at aggregate discounts that don't actually correlate to the cost of individual drugs.
I hesitate to use the word scam, but it feels kind of scammy to me.
Yeah,
Um,
that's right.
it feels kind of scammy. What it makes me wonder, okay, so if I'm Home Depot in this example, how should I go about choosing a pharmacy benefits management partner? Because there's so many different ways to play the system. Is there like a Better Business Bureau for PBMs somewhere I can check and say, yeah,
Yeah.
this guy's legit, this one isn't, or how do I
Yeah, so
even know?
it's a great question. So typically the way that it works is if I'm Home Depot, I say, look, I need to put together benefits for my employees. And again, I'm really good at home improvement supplies and, purchasing hardware, but I know nothing about employee benefits. So I'm actually going to contract with what's called a benefit consultant or a benefit broker, and they're going to be my expert. So I'm going to pay them to go out and, based off of my needs, curate a list, and not just for pharmacy benefits, but for medical benefits, for 401k, for dental, vision, right? All the benefits that typically are offered by an employer. And that benefit broker's job is to kind of be what you just mentioned, kind of the Better Business Bureau of saying, hey, I'm going to recommend them to you, and I'm going to go through the vetting and negotiation on your behalf and making sure you're getting a good deal. The challenge with that, that's often unknown, is that there's also payments or kickbacks that go from these benefit consultants to these large big health companies.
Hmm,
And thus they're incentivized to pick, the one that's paying them the most. And
sure.
unfortunately, the employer typically has no idea that that's happening.
And that scammy feeling returns.
Exactly. The scam continues, and here we are.
If companies understood how these benefits work the way they understand payroll, what do you think companies would do differently?
Yeah, I think, and it's starting to become more and more relevant. As I
Mm,
was mentioning, there's the pharmacy benefit game is getting somewhat exposed, and so there's a number of, alternative pharmacy benefit manager, challenger pharmacy benefit manager companies and options out there. But the way that the employer, in this case Home Depot, gets to a decision-making process that's a little more clean and pure is moving towards an evaluation that is, instead of discount based, it's cost based. So it's saying it's
mm.
getting to the what really matters to the employer, right? I'm paying, X millions of dollars today for pharmacy benefits. If I move to you, what am I going to pay tomorrow? And looking at it at a net cost level as opposed to these kind of roll up discounts. That's kind of the first step because it allows you to hopefully compare in more of an apples and apples comparison of, am I getting a good deal? The second piece of it is the contracting framework that exists between the pharmacy benefit manager and the client, right? And there's this concept in the benefits world, it's called being a fiduciary, right? Meaning that I'm going to work in the kind of the best interest of my employees and the benefits that I'm providing them. And so there's some kind of alignment principles that could be in a contract that ensure that the pharmacy benefit manager is working in your best interest in terms of not doing those spread pricing games, and that the only source of revenue they get is an admin fee that they're disclosing and charging you, and that they're not providing kickbacks to, the benefit consultants that you're working with. And so it does take some work and some education on the employer side, but there's definitely alternatives and ways that they can avoid getting, falling into these traps.
Yeah, as you're saying it, I'm putting myself in the seat of an HR leader, right? And I'm thinking, okay, this PBM, this pharmacy benefits manager is telling me all these wonderful things, but they could be getting over on me, and I have no idea because I don't know
Yeah.
what I don't know. I don't even know what to ask. So give me a little cheat sheet, things
Yeah.
I could ask them to make them go, oh, maybe I can't get over on this guy. Let me let me tell him straight because he asked me this question.
Yeah, absolutely. So I think, we touched on a few of them, right? It's, you being able to or willing to rep and warn in a contract that your only source of revenue is the admin fee you're charging. I think that's a good first step. The other
Hmm.
piece that commonly can happen in the contract negotiations between the pharmacy benefit manager and the pharmacy, right, is they'll actually negotiate with the pharmacy some aggregate discount. And then what that allows them to do is to have custom kind of pricing for all of the different clients they have. So if I have, 4,000 clients or employers that I'm working with, Home Depot and Lowe's and Target and you name all the employers, well, in this construct with the pharmacies, it actually allows me to determine like what price each of those individual clients are paying. And so what that ends up doing is inevitably um, some clients end up subsidizing other clients. And so another question that you can ask, right, is the pricing that I'm going to have with you, is that, the best pricing you have with the pharmacy? And would you put that in a contract? Or do you only have one price with the pharmacy across all your clients, which would be the perfect scenario, right? It would be in that example, you would then be working with a PBM that is more like Kayak or Expedia, where they become a platform and they're just, surfacing all of the pricing options, right? If you look at, how Expedia works today, if I want to go, fly to Washington, D.C., I'm going to put in my destination and it's going to show me the prices at Delta and Southwest and American
Sure.
Airlines and so on and so forth. And
Mhm.
those prices are going to be the same whether I'm looking at it or Jim, you're looking at it at the same time, right? They're not kind of picking and choosing based off of, how frequently we use Expedia. And that's really what a
Great.
PBM should be. That was their intention, right? Was started out as a technology solution to better help facilitate pharmacy benefits and then turned into, we can negotiate and help you save money, but it should be done in more of like a platform type concept.
Hmm. Okay. Okay. Let me think of with my recruiter hat on here for a minute. And I'm talking to a candidate,
Yeah.
and they received a counter offer to my offer. So they have two offers. The salaries are basically the same, you know, but it's going to come down for them who offers the best benefits. So how much of an advantage is it to me to have really great pharmacy benefits compared to the company I'm trying to recruit, um, compared to the company I'm competing with for this talent, if that makes sense?
Yeah. No, it does make sense. And I do think that in an indirect way, the pharmacy benefit manager that's being used by the employer can actually help in this scenario. And the
Okay.
reason that they can help is the cost savings that can come by working with an aligned pharmacy benefit manager. So typically, if we have, again, we have over 4,000 clients, and many of them are coming just by nature of, big health having 80+% of the market are coming from those scenarios. And typically, when you go from more of a traditional kind of legacy type pharmacy benefit manager business model to one like ourselves, the savings can be 15 to 20% off of where you're spending today. And so
Mm.
if I'm an employer and just by changing vendors, I can save that much on pharmacy benefits, which pharmacy benefits are now, 30 to 40% of your overall healthcare spend. Those are real dollars. And what that can mean is I can lower premiums, right? And so now to your point of, okay, salaries are the same. Now, what's the premium I'm going to be paying for health benefits? It could be lower with employer A because they're using a better pharmacy benefit manager. Um, it also could go to the bottom line of being able to even hire, right? Now I actually have dollars, and so I can actually hire and grow my workforce. Whereas if I'm, paying this tax to this kind of legacy PBM model, that's revenue out the door that I don't have to be able to grow my business.
Okay. Okay. You mentioned money, mentioned revenue, makes me think about money, which makes me think about scammy feelings I had earlier. At what point does profit-driven drug pricing cross an ethical line, right? And do you believe we've already passed it? Because I'm
Yeah,
kind of wondering.
no, it's a good question. I do
Okay.
think there's no question that drug innovation and the cost that it takes to bring a drug to market is costly, right? It's
Yeah.
billions of dollars to do that. And so I do think there's a world where, patents are okay. And if a manufacturer is investing all of this money to bring a drug to market, they should have exclusivity for a time, right, to recoup those costs. I think the challenge in the world that we live in today is that a lot of these drug companies have turned into patent litigation firms, really, right? And it's like they've got a
Mm.
whole, they probably have more lawyers on staff than they have R&D people because it's I bring this product to market and now I need to come up with all of the, patent law and patents to be able to keep it and extend it as long as possible. A good example.
Yeah, I see that in Silicon Valley quite a bit. Like
Yeah,
some people, some companies just make tools just so that someone else can't get it, or they'll hire people
yeah,
just so somebody else can't hire them.
exactly. So a good
Yeah.
example of this is there's a drug that's called Humira. It's
Okay.
a
I've
specialty
seen their
medication.
commercials.
You've probably seen commercials. Was the highest grossing drug of all time. Hundreds of billions of dollars were made by the drug company AbbVie. The drug had been on patent without competition for over 20 years, when normally it's about 10 or so. And the reason why it happened is because they were able to, slightly tweak the product and then get a new patent. And then, maybe change the dose a little bit and then get a new patent. And so they had hundreds of patents on this product. And in that scenario, right now you're just taking advantage of the situation. And so I think if the pharmaceutical industry operated under how it should be, which is you invest money, you bring a drug to market, I'm going to make as much money as I can in the 10 years that I have of patent and exclusivity, but then I'm okay letting it become a generic and have competition, then it's okay. And I think that's how the business should work and that everybody kind of wins in that scenario. When they don't
How
win,
likely is that scenario going to happen?
it's a good question. We're actually at an interesting inflection point because
Mm.
pharmacy costs have become so high. It's not uncommon for small employers now, especially with some of these high cost specialty medications, just to throw their arms up and say, hey, I can't afford it, right? This is the difference between me keeping the lights on as a company and paying for healthcare. And so I'm actually not covering these medications anymore, which in those scenarios, it's sad for the patient, right? Or the employee that's working there because now they can't get access to a potentially life-saving medication. And so we're seeing these kind of collisions in the marketplace now where employers are starting to exclude or not cover medications, and employer and
Okay.
pharmaceutical companies are having to figure out solutions to that. So I do think we're not there yet, but we are in a scenario where drug manufacturers are looking at things differently. And we're seeing that now with some of this kind of direct to consumer work that manufacturers are doing where they're putting out, low list price products and trying to avoid the rebate games and all of the things that big health is pushing. And so we're slowly getting there
Nice. Okay. So it's good to know that some employers are challenging the system, I guess, and not just
Yeah,
accepting it. Pharmacy costs is unavoidable.
for sure. Yes.
Cool. So what leverage do employers actually have that they don't realize they have? Is it that they can push back?
Yeah, I think it's that if you're an employer and you're self-funded, meaning you're paying your health benefits, right? You have control.
Yeah.
Like you're the one that's in control of the benefits. I think Understanding that you have that control, and as a result of that, you should have access to data. You should know how much you're spending on medications, and really pushing your pharmacy benefit manager, switching your pharmacy benefit manager to one that's more aligned with you is a good place to start. And that works with the benefit brokers and consultants they're working with as well, right? Like you're their customer. And so if you feel like they're, getting kickbacks and they're not aligned with you, then fire them and find a new one, right? There's plenty of options out there in the marketplace.
Hmm. Yeah. Okay. Okay. If let's say nothing changes, everything is the same today as it's always been, at least in the past decade. What
Yeah.
what do pharmacy benefits look like for employees 5 years from now?
Yeah, sadly, I think what we're on is really a runaway train when it comes to pharmacy costs. You've seen, if you look at the trends of, what spend has been on the pharmacy side for an employer, it's only increased. 10 years ago, it encompassed probably 8 to 10% of your overall healthcare spend. And so there was a huge focus on just, how do I manage medical costs and like hospital payments and things like that. And pharmacy was kind of just like on the backside that nobody really listened to.
Hmm.
Today, it's not uncommon for it to be 35 to 40% of overall healthcare spend. And so that increase itself, I think that continues and it's just, up and to the right, which then leads to, like you were mentioning, employers fighting back and sadly saying like, look, enough's enough. I only can cover a portion of pharmacy benefits. An employee, if you happen to have a disease that's really expensive, I can't pay for you because it's unsustainable.
Wow. You sort of answered the question I was thinking in my head. Could rising drug costs force employers to stop offering health benefits at all? What
Yeah,
a uncomfortable position that will put a lot of people in. If
absolutely.
that would
It
happen.
really, no, it really is. Like it's kind of the sad state of I think where we end up if change doesn't happen.
One last question for you, because I feel like I feel like I could ask you 100 questions. If you could deliver one uncomfortable truth directly to HR leaders listening right now, what would that uncomfortable truth be?
I think the uncomfortable truth would be if you're using one of the big health companies as a pharmacy benefit manager today, you're overpaying for your pharmacy benefits.
Mm,
And there's solutions out there that not only can lower your costs, but can provide a better level of service for your employees. I think that's one of the, I think, misconceptions out there is, oh, these companies are so big. How could, a challenger PBM ever negotiate as good pricing or take care of my patients as well? It's kind of like the adage of no one was ever fired for picking IBM. Well, unfortunately, that's not the case anymore. In fact, it's the exact opposite. That employers are now getting sued for picking IBM in this scenario,
mm,
and so you're really not as a fiduciary safe today using one of the big health companies for pharmacy benefits.
wow. Well, in the power I have as a podcaster, I'm going to designate you the patron saint of pharmacy benefits.
I will take that charge, and we will continue to improve healthcare one step at a time.
If somebody had more questions for you, or had questions for you that I did not ask you, because I still have at least 100 more that I want to ask you, how can they find you online and continue the conversation?
Yeah, so reach out to me on LinkedIn, Alan Pannier. And you can email me as well. So alan.pannier@SmithRx. But happy to answer any questions, go deeper, geek out in pharmacy benefits to the extent that you're
I've never heard geek out and pharmacy benefits in the same sentence before. You truly are the patron saint of pharmacy benefits. Alan, thank you so much for your time. I appreciate you being on the Jim Stroud podcast.
Awesome. Thanks, Jim. It's been a pleasure.
Well, my time is up. I thank you for yours. I'll see you again real soon, right here, with a brand new episode of the Jim Stroud podcast. If you have any questions, comments, or concerns, feel free to reach out to me. I can be reached by email at jimstroud@jimstroud.com. And one last favor, if I may ask, please rate this podcast. 5 stars is preferred, but please comment with your honest opinion. I really appreciate that. All right. Okay, until next time, bye bye.